guys, this is Ushma Tandel. Thank you for your support. I'm very close to reach 10,000 subscribers, and this wouldn't have been possible without your support. So what does that mean? It means that from now I can make more and more videos and I can reach out to more people. Your support helps me motivate myself and also helps me keep going. So I am forever thankful for you for this. If you have already not subscribed to my channel, please subscribe to the channel and click the bell icon so that you can get notification of all my latest videos. And at the end of this video, if you like this video, do give it a thumbs up. And also comment on the comment section below with all your feedbacks, suggestions and any questions that you have. This will help me make better videos, improve my videos, and also I will try to cover the topics which you are interested in. In this video, I will discuss the topic, what is clinical hypnosis? I have written a blog on this topic, so for people who have already read the blog, this video might be a repetition. So, okay. Whenever I tell someone I am a clinical hypnotherapist, they all become very curious, very interested. They all want to know more, like what is it, how does it work, and in what conditions can it be used. Sometimes they even ask me if I teach them how to hypnosis, will they be able to control other people's mind? And they get very disappointed when I tell them that is not possible. So typically, when we hear the word hypnosis, the first thing that comes to our mind is a therapist who is hypnotizing his client using a pendulum. And then, secondly, the most dreadful thought that comes to our mind is that the therapist is controlling his mind and forcing him to do horrible things like stealing a bank, killing someone, etc. That is why people are scared to use this form of therapy. To be honest, once upon a time, even I had similar ideas about hypnosis, thanks to the videos and the movies and the stage shows. But as I gained more and more knowledge about hypnosis, clinical hypnotherapy, my misconceptions around these subjects started getting cleared. I realized the true potential of this form of therapy in so many conditions. There are so many myths and mysteries surrounding this subject, so much so that as a clinical hypnotherapist, I thought it is my duty to come and explain to you what is hypnosis and how does it really work. Have you ever wondered what is clinical hypnosis? If yes, you are at the right place. So let us first begin by defining what is hypnosis. It is defined as a trance state characterized by extreme suggestibility, relaxation, and heightened imagination. Unlike the sleep state, in which you are oblivious of what is happening around you, the hypnotic state is the one in which the conscious mind is awake and is aware of what is going on, simultaneously providing access to your subconscious mind. In fact, we all experience hypnotic trance very regularly in our day-to-day lives, such as while reading, performing an art form, watching a movie, or while driving. Before we understand how hypnosis works, let's briefly understand the subconscious mind and the conscious mind. Let's assume this is a mind. Our mind basically has two components, known as conscious mind and the subconscious mind. Conscious mind is the one which analyzes, thinks, uses logic. That is, basically, processes every information that we take in. It constitutes to 10 to 12% of our mind. It comprises of our willpower, rationalization and logic, reasoning, short-term memory, decision making, and planning. The balance 88 to 90% is the subconscious mind. It is here where we store all our life experiences, which have been processed in our conscious mind. It has no judgment of its own. It also controls all the autonomic processes that you don't have to think about, like the heart rate, the blood pressure, tissue growth, cell regenerations, the immune system, and so on. It comprises of long-term memories, emotions and feelings, habit patterns, relationship patterns, addictions, creativity, spiritual connections, intuitions. And now comes our critical mind. A part of it is in the conscious mind and part in our unconscious mind. It develops at around 8 years of our age. By this age, we learn to analyze all the informations from our conscious mind based on our experiences in the subconscious mind. And we make our own set of rules and beliefs. It is meant to protect us. Our life operates as a combination of both these minds, that is, rules and experiences. When our rules and experiences are in sync with each other, we are happy. But when they are not in sync with each other, it leads to conflict. Let me explain you with few examples. As a child, if someone is deprived of food due to any reason, this might lead her to constantly crave for food. In future, even if the situation changes, she will still tend to overeat, eventually leading to obesity. Consciously, she might try to control her appetite, but it just keeps getting worse. This is because her cravings come from this feeling of deprivation experienced in her childhood, which has been stored in her subconscious mind. And we already know subconscious mind is more powerful than the conscious mind, and subconscious mind has no logic of its own. So it just continues to behave the same way. If, as a child, while playing you happen to kick a street dog, that dog bites you, following which you had to take all those painful anti-rabies injections at that time. So after that, whenever you see a dog, the memory of the bite and the painful injections get triggered. You start palpitating, sweating, and you just want to run away from that place. You will react the same way even with the pet dogs, though you know they are safe and won't bite you. This is because you have made an association of the dog with the bite and the pain at the subconscious level. One interesting observation regarding the conflict between subconscious mind and conscious mind that I have come across in my clinical practice is that many people have fear of success. This is because these people believe that with success comes arrogance and selfishness. Successful people have no time for their near and dear ones and therefore eventually lead a lonely life. Interestingly, even they are not aware of this belief that they have at the conscious level, and therefore they try their best to achieve success. But subconsciously, they themselves will sabotage it either by falling sick just before their final performance or by picking up a fight with their boss just before the expected promotion. These conflicting beliefs lead to frustrations and unhappiness. It is only through meditation, hypnosis, and similar methods that these people are able to dig into their subconscious mind and get solutions to their problems. We all have many such beliefs because they were required at some point of time. It's a part of our defense mechanism, which then becomes a part of a learning and growing up process. Depending on how intensely we perceive this conflict, we attach our emotional charges around that memory and store it as a negative or a positive experience in our subconscious mind. When it happens for the first time, we physically and psychologically respond to it based on what is appropriate at that point of time. We make a lot of association with that particular event. So the next time a similar situation arises, that particular memory gets triggered, and we subconsciously automatically start responding to it in the same way. When this occurs repeatedly, it becomes our pattern. So in future, even though the situation may have changed and you no longer need to react in that way, but still you end up doing the same things. This particular behavior is beyond your conscious control. This explains why we tend to overreact in certain situations, and this is how we develop patterns in life. During hypnosis, the therapist guides you into your own subconscious mind and helps you see your own thoughts more clearly, but only if you intend to see it. You can identify your own patterns. The therapist also takes you to the first event which triggered this particular type of response. Once the cause is known, the therapist helps you disconnect from the beliefs and associations which you no longer require, and then help you reprogram old beliefs and associations. You understand it and neutralize the emotional charges around it, enabling irrational fears, phobias, negative thoughts, and suppressed emotions to be overcome. Now that you understand how your mind and hypnosis works, let's find out where all can we use clinical hypnosis. It can be applied to a variety of psychological, emotional, and physical disorders like various phobias, fears, and anxieties, panic attacks, or obsessional compulsive behaviors, conditions exacerbated by tension such as irritable bowel syndrome, psoriasis, and eczema, stress related problems like insomnia, addictions such as smoking and alcoholism, relieve pain in surgery and dentistry and obstetrics, bulimia, post traumatic anxiety, grief and loss, depression, past life regression, self hypnosis, focus and concentration, general healing, performance anxiety. History of hypnosis: Sumerian, Persian, Chinese, Indian, Egyptian, Greek, and Roman culture used hypnosis in some or the other form. Egyptian sleep temples, 4,000 years ago was an early instance for hypnosis. In 1821, Recamier, in 1834, British surgeon John Elliotson, and from 1840s to 1850s, Scottish surgeon James Estyle performed over 2,000 minor and 345 major operations using hypnosis for anesthesia. In World War I, World War II, and even the Korean conflict, it was successfully used for pain relief on battlefield when morphine was not available. Research on hypnosis. Various studies have shown that hypnosis improves symptoms and quality of life of people with irritable bowel syndromes. Studies have also shown that it is an effective mode of treatment for muscular face and jaw pains, headaches and migraines, hypertension, obesity, insomnia, anxiety, and pains related to cancer. Other studies show that individuals who use self hypnosis audio tapes at least 3 to 5 times a week reported the highest level of self esteem and serenity, and the least anger and impulsivity. Patients who are prepared for labor and delivery in hypnosis are more likely to absorb and benefit from information because they are in a relaxed, highly focused state. Hypnosis has been shown to be effective in helping people to stop smoking and in controlling overeating. US Olympic athletes use hypnosis to win. It only makes sense that hypnosis is a tool to use to increase one's motivation. The experience of hypnosis differ from person to person. Some people might feel drastic changes immediately, and some people might feel they were not even hypnotized. It all depends on your level of willingness to receive and to let go. Hypnosis will only assist you in your own journey to self awareness. Thank you for watching this video, and please don't forget to comment if you have any question or suggestions. Thank you.